Good evening, everybody. It is Steve Lookner with Agenda Free TV. We are here to bring you a live update on the growing Texas measles outbreak. It is now up to 124 cases. One child has died. It is the first measles death in the United States since, I believe, 2015. And more cases are expected. So we are going, yes, the first U.S. death from measles since 2015 was announced today. So we are going to bring you a live update. We're going to take your comments and questions on the air. And actually, there was late today, there was actually, I just realized this, there was a local press conference about the outbreak, which I haven't even watched yet, but we're gonna take a look at that as well. Okay, so let's get into this. I do appreciate our moderators all being here. Thank you. We have moderating right now Sabrina and Ruth Krafasi and Beth Mythical and Roberts May Queen over there on YouTube. Thank you. Also, Linda Belk, Larry, Misha on X. Over on Twitch. Oops, let me just open it up here. On Twitch, A Moment of Lovely, Big Ball of Yarn. Matthew Kohai 3, Mick Britches, and Surly Dev. And also, I want to thank our Facebook moderators as well. Margaret Riley, K. Lowry Body over there on Facebook moderating right now. Thank you so much. All right, let's discuss this. By the way, what is measles? Really quick, let's just talk about what measles is. Let's talk about what it is. As the CDC says, it's very contagious and can be serious. It's very contagious. As CDC says down here, if one person has it, up to 9 out of 10 people nearby will become infected if they are not protected. So if you haven't taken the vaccine or you don't have natural immunity, say I believe from having had it before, then up to 9 out of 10 people nearby will get it. That's pretty contagious. Hang on a second here. So measles is very contagious, can be very serious. Anyone who is not protected against measles is at risk. And 2 doses of MMR vaccine provide the best protection against measles. What it is, some people think of measles as just a little rash and fever that clear up in a few days. But measles can cause serious health complications, especially in children younger than 5 years old. Measles is highly contagious. If one person has it, up to 9 out of 10 people nearby will become infected if they're not protected from being vaccinated or having had measles before and having natural immunity because of that. The best protection against measles is measles, mumps, and rubella MMR vaccine. MMR vaccine provides long-lasting protection against all strains of measles. Signs and symptoms. Measles symptoms appear 7 to 14 days after contact with the virus. 7 to 14 days. Common measles symptoms include high fever, may spike to more than 104 degrees, cough, runny nose, red watery eyes, and rash. Measles can cause serious health complications, especially in children younger than 5 years of age. Common complications are ear infections and diarrhea. Serious complications include pneumonia and encephalitis. Anyone who is not protected against measles is at risk. Measles was declared eliminated from the United States in the year 2000. However, measles is still common in many parts of the world. Every year, measles is brought into the U.S. by unvaccinated travelers who get measles while they are in other countries. Those travelers are mostly Americans and sometimes international visitors. Some people are at a higher risk of experiencing complications from measles. Measles is very contagious. It spreads through the air when an infected person coughs or sneezes. You can get measles just by being in a room where a person with measles has been. This can happen up to 2 hours after the person has left the room. And the best way to protect yourself against measles, says the CDC, is with the MMR vaccine. It is safe and effective. 2 doses of MMR vaccine are about 97% effective at preventing measles. Doesn't guarantee you won't get it, but it is about 97% effective at preventing it. 1 dose is about 93% effective. Okay, so I just wanted to go over what it is. Just to go over what it is. Now, let's talk specifically about this outbreak in West Texas. By the way, one of our viewers said, how long does the MMR vaccine last? The CDC says that, from right here, just to be clear, I'll post this link in the chat, but the CDC says, it's on this page, people who receive the MMR vaccination according to the U.S. vaccination schedule are usually considered protected for life against measles and rubella. Anyways, I'll post a link to the MMR vaccine info page from CDC if you want to read more. Okay, so I want to show you some information about the current outbreak. Let's talk about that. Here. Measles outbreak. This is from the Texas Health Department. The Texas State Department of State Health Services is reporting an outbreak of measles in the South Plains region of Texas. South Plains region of Texas. I want to show you on a map where we're talking about here. This is rural West Texas, I believe. Yes. Here, this is from Wikipedia, South Plains, Texas. It's a region in northwestern Texas. And if you look at the map, that's where we're talking about. That's the map here. If you guys can see this. There you go. There's the map from Wikipedia, South Plains, Texas. That's not everywhere measles is. That's just the map of where South Plains, Texas is. Northwest Texas. Okay, so the Texas Department of State Health Services is reporting an outbreak of measles in the South Plains region of Texas. At this time, as of yesterday, 124 cases have been identified since late January. 18 of the patients have been hospitalized. By the way, NBC News had a quote from the chief medical officer of, was it Covenant Children's Hospital? I'm looking it up right now. Yes, the chief medical officer of Covenant Children's Hospital in Texas told NBC News that around 20 children with measles had been treated at the hospital, and said that of those people, of those 20 children, around 20 children treated, they all were having trouble breathing. And she said none of those children who they had treated at that hospital had been vaccinated. They all were unvaccinated. Again, that's according to Dr. Laura Johnson, the chief medical officer at Covenant Children's Hospital in Lubbock, according to NBC News. So I was just mentioning that because this talked about people who'd been hospitalized. The chief medical officer at that hospital said that the hospitalization number seems to be lagging. So she said they had treated about 20 children. Five of the 124 cases are vaccinated. Remember, if you get vaccinated, it gives you around 97% protection against getting the virus, getting measles. But that doesn't mean you can't get it. You can get it if you're vaccinated. You're just a lot less likely to. So five of the 124 cases are vaccinated. The rest are unvaccinated or their vaccination status is unknown. Due to the highly contagious nature of this disease, additional cases are likely to occur in the outbreak area and the surrounding communities. DSHS is working with local health. So again, additional cases are likely to occur. It can take symptoms usually appear in 7 to 14 days, I believe the CDC said. Didn't they? They said, where is it here? Measles symptoms appear 7 to 14 days after contact with the virus. So there could be people who are going to be symptomatic in several days or over a week from now. We will post updates on Tuesdays and Fridays if there are new cases to report. So they list different counties here. Gaines County has 80 of the cases. There's also cases in Dallam, Dawson, Ector, Lubbock, Lynn, Martin, Terry County is 21, Yoakum. And they also, if you look at the age ranges of the cases, 39 cases, 0 to 4 years old. 62 cases, 5 to 17 years old. So 101 of the 124 cases are 0 to 17 years old. 18 plus years, 18 years old, and 5 pending. The best way to prevent getting sick, says the Texas Department of Health, is to be immunized with 2 doses of a vaccine against measles, which is primarily administered as the combination measles, mumps, rubella, MMR vaccine. 2 doses of the vaccine are highly effective at preventing measles. And then there was a death announced today. Let me just mention the fatality, and then I will take some comments here. But let me just mention the fatality. This is from the also from the Texas Department of Health. Let me show you what they had to say about that today. Hang on, I'm pulling it up on the screen right now for you. There it is. Texas Department of State Health Services. Texas announces first death in measles outbreak. This was today. This is the first measles death in the U.S. since 2015. The Texas Department of State Health Services is reporting the first death from measles in the ongoing outbreak in the South Plains and Panhandle regions. So South Plains and Panhandle, they say. The school-aged child who was not vaccinated. So this was a school-aged child who was not vaccinated. I don't know anything more about this person. Condolences to the child's family. The school-aged child who was not vaccinated was hospitalized in Lubbock, Texas last week and tested positive for measles. As of February 25th, 124 cases of measles have been confirmed in the outbreak. Since late January, most of the cases are children. 18 people have been hospitalized over the course of the outbreak. Measles is a highly contagious respiratory illness, which can cause life-threatening illness to anyone who's not protected against the virus. During a measles outbreak, about 1 in 5 people who get sick will need hospital care. That's a lot. Remember, remember what CDC said about how contagious this is. CDC said, where is it here? As I pull it up. Measles is highly contagious. If one person has it, Up to 9 out of 10 people nearby will become infected if they're not protected by vaccination or by having had measles before. So, add to that the fact that about 1 in 5 people who get sick will need hospital care. So if you have a lot of people getting measles, that's going to be a bunch of people needing hospital care. And 1 in 20 people who get measles in a measles outbreak will develop pneumonia. Rarely, measles can lead to the swelling of the brain and death. It can also cause pregnancy complications such as premature birth and babies with low birth rate. People who are infected will begin to have symptoms within a week or two after being exposed. Measles can be transmitted by direct contact with infectious droplets by airborne spread when an infected person breathes, coughs, or sneezes. Early symptoms include high fever, cough, runny nose, and red and watery eyes. A few days later, the telltale rash breaks out as flat red spots on the face and then spreads down the neck and trunk to the rest of the body. A person is contagious about 4 hours before the rash appears to 4 days after. People who could have measles should stay home during that period. So there could be someone who has some symptoms. Maybe they think they have a cold or something and they go out, and then a few hours later they start having a rash, and they could have been contagious for several hours before the rash. Actually, more than that. I'm sorry, I said 4 hours. 4 days. A person is contagious, I misread that. A person is contagious about 4 days before the rash appears. So it could be 3 days before you get the rash. And you don't think you have measles, and you're walking around doing whatever, and measles could be spreading from you to other people. People who think they have measles or may have been exposed to measles should isolate themselves and call their healthcare provider before arriving to be tested. It is important to let the provider know the patient may have measles and get instructions on how to come to the office for diagnosis without exposing other people to the virus. It is very contagious. The best way to prevent getting sick is to be immunized with 2 doses of a measles-containing vaccine, primarily administered as the MMR vaccine. 2 doses of the MMR vaccine prevent more than 97% of measles infections. A small number of vaccinated people can occasionally develop measles. In these cases, the symptoms are generally milder, and they are less likely to spread the disease to other people. CDC recommends children receive 1 dose of MMR at 12 to 15 months of age and another at 4 to 6 years. Okay, so I'm going to take some comments from you guys. But again, this is a highly contagious virus. If people are in a room with somebody with measles, if you are nearby, it says nearby. If one person has it, up to 9 out of 10 people nearby will become infected if they are not protected. Meaning no vaccine, no natural immunity from having had it before. And the symptoms can take 7 to 14 days to show up. So I'm going to show you this shortly, but some of the local health departments have started to issue alerts saying like, hey, if you were in this location during this time period, be aware that you might have been exposed to measles. There was a new one of those today, actually. I think, did Lubbock Health Department release that one? I haven't even checked all the health departments. I should check. Yes. Where is it here? Hold on. Thought it was here. Here it is. Look. Two community exposure sites Lubbock Health Department talked about. This is new. This is just a couple hours ago. I think they posted this an hour or 2 ago, somewhere around there. Let me just show you that. Then I'll take some comments. Here it is. I'm going to post it. Lubbock Public Health has confirmed 2 community exposure sites related to the current measles outbreak. Walmart and Target. Walmart and Target. 5:30 p.m., February 19th, Walmart, Lubbock, Texas. February 20th, Target, Lubbock, Texas. If you are concerned about potential exposure at the locations listed above, please monitor for symptoms such as fever, cough, runny nose, red eyes, and a red rash. Vaccinated individuals are unlikely to contract measles. Those at greatest risk for contracting measles are those who are not vaccinated or have not had prior measles infection. And this was posted by the City of Lubbock Public Health Department at 5:12 p.m. today. I assume that's local time. Yeah, about an hour and a half ago they posted that. Hang on a second here. Okay, I want to take some comments from you guys on all of this. First of all, let me say a quick thank you to Carbon Forms, who says, Harvard Medical School Inside Immune Amnesia is a good article. Immune amnesia is an important feature of measles. I don't know anything about this. I'll have to look it up. I'm not familiar with that. Google AI says, immune amnesia is a phenomenon where the immune system temporarily loses its ability to recognize and fight previous infections after a measles infection. Measles virus can suppress the immune system, leading to the destruction of memory cells, says Google AI, Gemini AI. These memory cells are essential for recognizing and responding to previously encountered pathogens. As a result, people who have had measles may become susceptible to infections they would have otherwise been immune to. It can last for several months to years after a measles infection. That's according to Google Gemini AI. Where are they getting that from? For example, there's something I see here from, where is this here? Can't even find it here. There's a School of Medicine they posted from, and again, I am not an expert on this. BBC had an article about immune amnesia in 2021, measles, the race to understand immune amnesia. Anyways, I'm not going to get into that here, but right now. But if you want to look up immune amnesia, you can look it up and find articles about it. There's plenty of them out there. Maybe we'll talk about it more later. There's a BBC article from 2024 that says scientists have known for years that measles can alter the immune system, but the latest evidence suggests it's less of a mild tweaking, more of a total reset. Again, I don't know. It's an interesting topic. Thank you to Carbon Forms. Thank you also to Sharkbite for being a member. Thank you, Tie Shoes, who says, I'm a healthcare professional and encourages everyone to get vaccinated for MMR, and other viruses and bacteria. Steve, did you see the report that the FDA Influenza Advisory Committee was abruptly canceled today? Yes, I don't want to get into it right now because it's a little off topic. I already posted this on my X account, but multiple outlets have reported that this flu vaccine meeting was abruptly canceled today. I really don't have any background on it myself right now. I'll look at it later in the broadcast. But I did post about it on my X account. So like Margaret Brennan she's with CBS News, she reported that the FDA vaccine committee meeting on how to update next season's flu vaccine was abruptly canceled today with no explanation. CBS News confirms. So again, I don't have much information on that right now. Maybe I'll look it up in a little bit. So I don't know. Maybe it's been rescheduled. I don't know. Maybe a little later we'll check back into that. Thank you also to Robert Womack, our member, Kender for the gift memberships. Thank you so much. Deshark for the gift memberships. Thank you. Also PZ Papa Zulu. Thanks for the gift memberships. Thank you. Rainbow Rabbit Hole, who I said, I had measles at 6 months old. 200 cases per year is normal. Well, the number of cases in the U.S., I think last year it might have been total around 200. And the year before that, I think around 50. Remember, there has not been a death in the U.S. from measles since 2015. Hang on, I'm going to get you some facts about this. Let's see here. I am trying to find a chart, historical chart, that I can give you some figures for the last several years. Where is this posted from? Reuters says in 2024 there were 285 cases. In 2023 there were 59 cases in the U.S. But again, no deaths since 2015. There's already been one now. And it's 124 confirmed, and that number is expected to grow. ChatGPT posted some sort of a chart which has the correct number for 2024 and 2023. It says before then there were, I'm just going to read you, according to ChatGPT, if you go back year by year, 2022, 121, 2021, 49, 2020, 13, 2019, 1274, 2018, 381, 2017, 120, 2016, 86. So if that's correct, it gives you a sense of what the U.S. case numbers are, generally. I don't have hospitalization data handy. Also, thank you to Givens Empaw, our new member, Laura G, our member, Robin, our member, and all of our moderators. I really appreciate you being here. Hang on a moment. I'm going to give you some more specifics about this particular outbreak. Hang on. Thanks again, Beth Mythical, for moderating. Sabrina, Keisha Fowler, Roberts May Queen. I got to take some more comments too and questions. Also over on Twitch, A Moment of Lovely, Big Ball of Yarn. LB Prairie Dawn, Matthew Kohai 3, McBritches, Sarah, and Surly Dip. Linda Belk, Larry, and Misha on X, thank you for moderating, and also Kay Lowry Body and Margaret Riley. You know, Robert F. Kennedy Jr., the Department of Health, the Secretary of Health and Human Services, said today during Trump's cabinet meeting there had been 2 deaths, but I haven't seen a second death reported aside from that. I've only seen 1 death confirmed. Again, Kay Lowry Body and Margaret Riley, thanks for moderating over there on X. Hang on a moment. Yeah, some of our viewers have questions like, you know, what's responsible for this outbreak? Let me get you some more reporting on it here. And there actually is, we're going to look at it, there was a press conference on this a few hours ago, which I haven't even gotten a chance to watch yet. I just heard about it, but I can show it to you. So we're going to show you that as well. You can see here, measles cases continue to rise in rural parts of West Texas with 124 confirmed. Thank you, Kirk Spaziani, by the way, for your support. Yeah, Lithrone mentions the Mennonite community. You can see here from AP, the measles outbreak in rural West Texas has grown to 124 cases across 9 counties. NBC News reports that this number is actually around 20 people hospitalized. Around 20 children have been hospitalized for this. The outbreak is largely spreading in the Mennonite community, in an area where small towns are separated by vast stretches of oil rig dotted open land, but connected due to people traveling between towns for work, church, grocery shopping, and other day-to-day errands. Again, they say the thing is though, Lubbock just reported that there was it sounds like a person with measles who was at the Target in the Walmart in Lubbock, Texas. So who knows how it's spreading? So they said the outbreak is large. As of yet, this article is from early today, I guess early this morning. The outbreak is largely spreading in the Mennonite community in an area where small towns are separated by vast stretches of oil rig dotted open land, but connected due to people traveling between towns for work, church, grocery shopping, and other day-to-day errands. Measles is highest highly contagious disease. This talks about some different counties. The state said there are 4 cases in Dallam County, which is in the far corner of the state's panhandle area and a couple hundred miles north of Gaines County, and potential exposures in mid-February from an infected contagious person who traveled to San Marcos, San Antonio, which is more southern Texas, and New Braunfels. Cases have been concentrated in a close-knit, under-vaccinated Mennonite community, a health department spokeswoman has said, especially among families who attend small private religious schools or are homeschooled. And who are the Mennonites in a Texas community where measles is spreading? Says AP. The Mennonite population being affected by a measles outbreak in West Texas is part of a larger, loosely affiliated group of churches worldwide with varied beliefs and leadership structures, and with sometimes strained or distant relations with health officials and other public authorities. Who are the Mennonites? Mennonites are part of the wider Anabaptist family of churches, which emerged in 1525 as the radical wing of the Protestant Reformation in Central Europe. Other Anabaptist branches today include the Amish, Brethren, and Hutterites. Anabaptists believed that a true biblical church had to follow such principles as nonviolence, unconditional forgiveness, adult baptism, church discipline, and a refusal to bear arms or swear oaths. Early Anabaptists suffered persecution and martyrdom under Catholic and Protestant rulers in Europe, a history that still influences some groups today in their suspicion of governmental authorities, including public health officials. Mennonites, named for an early leader, Menno Simons, vary widely in practice today. Some Mennonites have largely assimilated into mainstream culture and dress, with a focus on working for peace and social justice in the larger society. Other Mennonites maintain traditions similar to the Amish, with tight-knit separatist communities marked by such things as limited technology, nonviolence, male leadership, and traditional dress, including women's head coverings. Still others are somewhere on a continuum between such practices. There are more than 2 million baptized believers in 86 countries in Anabaptist-related churches. The outbreak has particularly affected Gaines County and some adjacent areas. While it's not immediately clear which Mennonite community has been affected, the Gaines County area includes a community with a distinctive history. Okay, I'm going to skip ahead a little bit. Gaines County is home to one of the highest rates of school-aged children in Texas who have opted out of at least one required vaccine, with nearly 14% skipping a required dose last school year. What are Mennonite views on vaccines, says AP. Historically and theologically, there has not been any religious teaching against immunization in Mennonite circles, said this person in an email, a professor at Elizabethtown College. There's no religious prohibition, no body of religious writing on it at all. That said, more culturally conservative Mennonites and Amish groups have tended to be under-immunized or partially immunized. Partly, he said, that's because they don't engage as regularly with healthcare systems as more assimilated groups do. Many traditional Anabaptist groups did accept vaccinations that were promoted in the mid-20th century, such as for tetanus and smallpox, but they have been more skeptical in recent years of newly introduced vaccines, Nolt said. What are state laws on student exemptions from vaccines? All 50 states and the District of Columbia require vaccines for students to attend school. All states allow exemptions for medical reasons, while most allow exemptions to mandatory vaccination for children for religious or personal reasons or both. Texas law allows exemptions for reasons of conscience, including a religious belief. U.S. kindergarten vaccination rates dipped in 2023, and the proportion of children with exemptions rose to an all-time high, according to federal data posted in 2024. A little background there on the Mennonite community. But again, just to point out, I mean, this has been spreading, and I showed you just a couple hours ago, the city of Lubbock posted that there were 2 community exposure sites related to the outbreak that they were newly aware of. February 19th, 5:30 p.m., Walmart in Lubbock. February 20th, Target, University Ave in Lubbock. So regardless of who originally was getting this, you know, if somebody gets it and they start driving around Texas or other states, it can spread to other people. I'm going to look up where these are. I'm going to show you a map too. So I don't know how much this is going to, how many new cases we're going to have and how much it's going to spread. All right, let me pull this up here. So here is Gaines County. Oops, hang on. There's Gaines County. Wasn't Gaines County the one that, I'll show you in a second. Gaines is the one that had the most cases, right? I'm going back here and making sure here. Gaines had 80 of the, yes, Gaines has 80 of the 124 cases. So let me show you that. Oops. I'm putting it on the screen for you. Gaines County, hold on. Get this so you can see what I'm doing. There's Gaines County. So we're talking western Texas. There's Lubbock right there. So Gaines County has 80 cases. And then the next highest county is, for cases so far, is Terry County with 21. And Terry County is not far from Gaines County. So in this area, western Texas, pretty rural there, as you can see from the satellite shot. But Lubbock is over here. And there were 2 community exposure sites in Lubbock, at the Target and at the, let's look up where the Target is in Lubbock, and the Target and the Walmart. Walmart 4215 South Loop. Okay, this is the Walmart Supercenter in Lubbock. This is where, according to City of Public Health Lubbock, City of Public Health Department in Lubbock, there was a community exposure at 5:30 p.m. on February 19th at this Walmart, 4215 South Loop 289. That is not a rural area, right? That's not in the middle of nowhere. That's in the middle of a densely settled area. Now, maybe a person drove there and was in their car going in and out of Lubbock. I don't know. But that's one of them. Right there. Where is it here? Right there. Walmart Supercenter. And the Target, where there was an exposure, I don't know if it's the same person who went to both these places. The Target is on University Ave. Here it is. Yes, this is not a rural location. There is the Target on the map. You can see it right there. That's it. That is not a rural location. That is not the middle of nowhere. That is in the middle of a densely settled, populated area. Again, for all I know, the person drove in from out of town, went to the Target, got back in their car, and left town. Or they could have been walking around town for 4 days. I have no idea. But the city of Lubbock issued an alert about those 2 locations, as I mentioned. And who knows, I don't know. I don't know. Maybe they just don't have information about where else the person or people has been, but you can see it right there. Lubbock Public Health has confirmed 2 community exposure sites related to the current measles outbreak. Where is the Walmart in relation to the Target? Somebody asked. I'll have to go back to the map and pull it up here. So you wanted to know how about directions from the Walmart to the Target? Okay. Oh, they're 2 miles from each other. The Walmart Supercenter and the Target, where the community exposure sites are in Lubbock, are about 2 miles from each other. About a 4-minute drive. I don't even know if it's the same person who was at both those places. Patrick says, do kids in Texas have to get vaccinated to go to school? Yeah, we mentioned that a few minutes ago. According to the AP article, all 50 states require kids to get vaccinated, but they have, in various states, there are various exemptions for things like medical exemptions and religious exemptions. All 50 states and the District of Columbia require vaccines for students to attend school. All states allow for exemptions for medical reasons, while most allow exemptions for religious or personal reasons. By the way, a quick thank you to RevWeb. RevWeb says, reasons of conscience allow parents to opt out. Also, a quick thank you to Kristen Gates. I really appreciate your support, Kristen. really do not know how big this outbreak is going to get. I should also check and see if Gaines County posted anything. Oh, hold on. South Plains Public Health District? I was at the South Plains Public Health District site. I was looking for... Oh, they linked to the state site, but they also say what to do if you've been exposed or symptomatic. If you believe you've been exposed to measles or experiencing symptoms, isolate yourself immediately to prevent the virus spreading to others. Watch for symptoms which typically develop 7 to 21 days after exposure. You can see here at Texas Department of Health and Human Services. This was February 5th. Back on February 5th, they said due to the highly contagious nature of this disease, additional cases are likely to occur. Back on February 5th, there were 6 cases. Now there's 124 with 1 death. A school-aged child who had not been vaccinated. One of our viewers, MartyTube, thinks somebody crossed the border with it. I don't know how this outbreak originated. I do not know. You can see Texas child is first reported U.S. measles death in a decade as outbreak hits. Now this says more than 130. Oh, because of New Mexico, right? An additional 9 cases were announced in eastern New Mexico, says Reuters, near the Texas state line. That's a good point, because Gaines County, you can see here, there's Gaines County where there's 80 cases. It's right next to New Mexico. So we got to keep an eye on New Mexico and other places too if people went to other states who have the disease. Hang on. You know, I should have said more cases. Texas is 124, but don't forget about New Mexico. They posted anything new? Hang on. Yes, here's the here's the New Mexico Department of Health update. I have their update. Give me a moment, I'll show you. Ready? Here. This is New Mexico. The New Mexico Department of Health is reporting an outbreak of measles in Lee County near Gaines County. Gaines County is the county in Texas with 80 cases. Well, Lee County, New Mexico is near Gaines County, Texas. The table below provides the latest case numbers. As of yesterday, because measles is so contagious, additional cases are likely to occur in Lee County, New Mexico, and the surrounding communities. Lee County, 9 cases. 4 of them 5 to 17 years, 5 18 plus years. So need to keep an eye on there as well. So just in those two states, there are now 133 confirmed cases. Is there a home test for measles? One of our viewers said. That I don't know. I just have to look it up. There is a web page for something called AccuQuick Measles Virus Antibody Test Kit. Does that detects the antibody produced by the immune system when measles infection or vaccination occurred during the antibody testing? I don't know anything about this. I am not a healthcare expert, so I'm not going to start opining on this stuff. It's a good question. For whatever it's worth, I asked ChatGPT, and ChatGPT said there is not a home test for measles. Oh, also, there's an American Medical Association article from last year in May, which says there's no home testing for measles. That's according to this AMA article I'm looking at. Speaking of, some of our viewers are talking about Robert F. Kennedy Jr. So, Robert F. Kennedy Jr. today said there were two people who were died. The Secretary of Health, the new Secretary of Health and Human Services, he said that two people have died, but I've only seen reports of one person dying. He also said, I believe that the 18 cases were mostly for hospitalized, were mostly for quarantine, which is just wrong according to the chief medical officer of a children's hospital in Texas. I'll talk about that in a second. Look, this is from Associated Press. A Texas child who was not vaccinated has died of measles, the first for the U.S. in a decade. RFK Jr. appears to misstate several facts. Robert F. Kennedy Jr., the nation's top health official and a vaccine critic, said today that the U.S. Department of Health and Human Services is watching cases and dismissed the Texas outbreak as not unusual. He appeared to misstate a number of facts, including making a claim that most who had been hospitalized were there only for quarantine. Dr. Lara Johnson at Covenant Hospital in Texas contested that characterization. We don't hospitalize patients for quarantine purposes, said Johnson, the chief medical officer. Kennedy also seemed to misspeak, saying two people had died of measles. A spokesman for the Department of Health and Human Services later clarified that the CDC has only identified one death. And speaking of that hospital and the chief medical officer, I think it was the same person. NBC News talked to, was it the same person? NBC News had a story today, and they reported that they spoke to same person as here, Dr. Lara Johnson, who is the chief medical officer at Covenant Children's Hospital in Lubbock. And Dr. Lara Johnson told NBC News that the hospital had treated about 20 children for measles, and that they were all treated because they were having trouble breathing, not because of quarantine. She also said none of those children hospitalized that they had treated had been vaccinated against measles. Yes, Callie Graham says it's super contagious. As the CDC says, right here, if one person has it, up to 9 out of 10 people nearby will become infected if they are not protected. Mona L, our viewer, says, aren't most people vaccinated for measles? It's a good question. The New York Times said that according to the CDC, oh, I have it. I have it right here. I don't even need that. I can show you the CDC page. Well, this says percent of children vaccinated by age 24. I don't know how updated this is. This says 2020 to 2021. This is 5-year-old data. 5-year-old data, as of 5 years ago, about 91% of children were vaccinated by age 24 months. And about 92% were vaccinated by 13 to 17 years with 2 doses or more. But that's several years old, that data. I don't know if they even have data up to date. Maybe they do for like the current year. I'm not sure. Let me see something here. Let's see if I can find anything else. Yes, they do. I got it. Here, right here. Coverage with selected vaccines and exemption rates among children in kindergarten, United States, 2023-2024 school year. During the 2023-2024 school year, 92.7% of kindergartners were vaccinated with measles, mumps, and rubella, according to the CDC. So most people in the country are vaccinated. But there can be areas of the country where fewer people are vaccinated. In a moment, I'm going to show you this update, this local update that the Lubbock Health Department did today. I'm going to show it to you. You can write to me on X at Lookner, by the way. Our viewer, Bucks Raise It, said, I had a professor in college who was a Mennonite. He was great. Many of these initial cases have been in a Mennonite community or communities. We were talking about that a little earlier. Thanks, Oregon guy, for shouting out our moderators. Bart Garcia sent me something which I did not see. University, what is this? Yeah, hold on. Is it University of Texas at San Antonio, UTSA? Roadrunners, we've been informed by the San Antonio Metropolitan Health District that an individual who lives in Gaines County and visited the main campus on February 15th for UTSA Day has tested positive for measles. We're notifying our campus community out of an abundance of caution. This was an email sent out with the UTexas San Antonio community on Sunday that a visitor from Gaines County, where there are 80 cases, toured the main campus on February 15th between 10 a.m. and 2 p.m. And that person has now tested positive for measles. They say, we believe the individual's infectious window was likely after their date of visit. Hopefully that's the case. However, out of an abundance of caution, we are notifying our community. Thank you, Bart, for writing in. Yeah, one of our viewers sent us the story that we talked about earlier today. This is not related to the Texas outbreak, but I don't believe. But Eyewitness News ABC in LA said an Orange County infant infected with measles arrived in LA at LA International Airport following overseas travel earlier this month. And health officials Wednesday are notifying passengers on the flight they have increased risk of exposure. But I don't believe that that's reported to have any connection to the Texas outbreak. Brooks Stratton is asking if people is the outbreak originating with people who didn't take the vaccine? Could it have originated with people who came into the country illegally? I do not know. I do not know. I mean, at a certain point, it's not just one thing, right? Because most of the cases, only 5 of the cases are people who are vaccinated. Of the 20, I just told you that a hospital officer, chief medical officer in, I think it's Lubbock, she said that they had treated around 20 children and none of them were vaccinated. So at a certain point, there's whoever the first person was, but it's not just the fact that the first person had it, it's that there's conditions which allow it to spread to other people. But I don't know specifically anything about the people who have had it. We know a number of them are in a Mennonite community in western Texas. All right, I think what we should do is maybe take a peek at, there was another thing I want to show you. I'm going to show you there was this press briefing on this today, which I haven't even had a chance to look at. There was something a couple days ago, though. Here, let me just show you this. So we're seeing these periodic alerts about when the authorities find out that a person who tested positive has been in certain areas publicly, and they want to let people know. So where is the one here? Right. So look at this one. This is from 2 days ago. Measles exposures in Central and South Central Texas. Multiple health departments in Central and South Central Texas recently reported measles exposures associated with an ongoing outbreak in the South Plains region of, this would be northwestern Texas. Healthcare providers in Central and South Central Texas are asked to review the information in this alert and be vigilant for cases of measles resulting from these exposures. Different part of Texas. Background: a measles outbreak centered in West Texas continues to grow. A person from the outbreak area who was later diagnosed with measles. This is from the Texas Department of Health. A person from the outbreak area who was later diagnosed with measles visited locations in the San Marcos and San Antonio areas on the weekend of February 14th to 16th. While they were contagious, a measles exposure may have occurred at the following times and locations. Remember, it can take 7 to 14 days or longer for symptoms to appear. So this is in San Marcos and San Antonio. So just to show you on a map what we're talking about. San Antonio is all the way down here. There's San Antonio. You know, I have to apologize. I don't know exactly where San Marcos is. San Marcos is outside of San Antonio. So Gaines County is up here. San Marcos and San Antonio are down here. You're talking hundreds of miles away. But what happened is a person from the West Texas outbreak area who was later diagnosed with measles visited locations in the San Marcos and San Antonio areas the weekend of February 14th to 16th while they were still contagious. A measles exposure may have occurred at the following times and locations. February 14th, 11 a.m. to 2 p.m., Alsop's Convenience Store, Wall. 3 to 7 p.m., Texas State University, San Marcos. 6 to 10 p.m., Twin Peaks Restaurant, San Marcos. Oh, and this was the University of Texas, San Antonio. Now, UTexas, if this is the same person, UTexas, San Antonio thought they were not in their infectious window then? So I don't know. Maybe the person wasn't contagious during this. I don't know. 10 a.m. to 4 p.m., University of Texas, San Antonio main campus. 2:30, 7:30 p.m., Tussauds, Waxworks, Ripley's Believe It or Not, and Ripley's Illusion Lab in San Antonio. And then Mr. Krabby's Seafood in Live Oak. And then Sunday, Buc-ee's in New Braunfels and Alsop's Convenience Store in Wall. So we've seen several of these these alerts in different communities saying you might have been exposed if you were in one of these places. As I mentioned just a few hours ago, the city of Lubbock came out and talked about potential exposures at a Target and a Walmart supercenter in Lubbock, Texas. That one right there. Steve the Book Guy says that is so many places. Yeah, and look, I mean, there very well could be other places. I don't know that the health department knows where everybody with this was at all times. Also, obviously, there could be people who are not symptomatic yet who are going to be symptomatic in the coming days. Holly Zane says, San Antonio is 4 hours south of me. Lubbock is 2.5 hours north of me. Callie Graham says, my grandkids live in New Braunfels. All right. Why don't we get you guys... Why don't we show you guys... and I haven't even looked at it yet. There was, several hours ago, late today, a press conference given by public health authorities in Lubbock, Texas, on this. And I think we should look at it. I want to see it. West Texas Measles Outbreak Update. So we'll check this out and see what was said in the press conference about this today. And again, I don't know how it's expected that this is going to grow. I don't know how much it's going to grow and spread. Do not know. Hannikin says, oh my goodness, Buc-ee's are so busy and crowded. In those lab science entertainment places, you touch so many interactive things. Okay. Is it dangerous? It can be fatal. I think we'll get more information here. Why don't we let's watch some of this update that was given today. I haven't even seen this yet. This was, I think, just a few hours ago from Lubbock Department of Public Health. Okay. So this was earlier today, I'll put on the screen. But just a few hours ago. Let's see what they had to say. We don't want the music to be playing. Here we go.
Joining us today, my name is Meredith Cunningham. I am the Senior Media and Community Relations Manager for Covenant Health. Covenant Health is part of the Providence family. This is a press conference held today jointly with both Covenant Health and the City of Lubbock Public Health Department. Here to speak with you is Dr. Laura Johnson. She is a pediatric hospitalist as well as our Chief Medical Officer for Covenant Health Lubbock Service Area. Along with her is Dr. Amy Thompson, who's also a pediatric hospitalist. She is the Chief Executive Officer for Covenant Health Lubbock Service Area. Can y'all hear okay? Okay. They have a statement that they are going to read, and then we will have time for questions and answers. Please keep in mind that there might be some answers that we're unable to provide today, of course, because of patient privacy and HIPAA laws. Right after this, we will be holding a prayer service across the lobby in our chapel. Everyone is welcome to join us. And before I hand it over to Dr. Thompson, just want to make sure everyone's phones are silenced, please. Thank you.
And just to clarify, this broadcast was shown on the, hold on, this is from the City of Lubbock YouTube channel. So they broadcasted this.
Yeah. All right, good afternoon. Thank you guys so much for being here with us today. And helping us share in this information with our communities. I'm going to read part of this and then I'll talk. So many of you saw that the City of Lubbock's press release this morning, but we're here to confirm that a patient has passed away from complications caused by the measles virus. The child was school-aged and did not reside in Lubbock County. We do want to say our thoughts and prayers are with this family as this is new news today. So this is still really fresh for them. Why did we do this today? Why did we choose to have a press conference to talk about this? And the way that I say this is it's because this is a big deal. And we have known that we've had measles in our community. We are now seeing a very serious consequence of what happens when we have measles in our community. And so we just feel like it's our obligation. I will tell you, actually, I'm the chief executive of the 4 Covenant hospitals here in Lubbock. But what I really am is a pediatrician. So I was a pediatrician for many years before I was a hospital administrator. And so this hits very close to home for us just because of our love for children. So as of today, more than 20 patients have been admitted to the Covenant Children's Hospital. We have several of those who have required intensive care as a result of having the measles. And as you can see from today's news, this virus can have severe and deadly consequences. We want to urge our communities to be vigilant, and you'll hear kind of the second part of what we want to do today is just continue to provide an opportunity for some education and questions about the measles. We want you to educate yourself with information from reliable sources like the city and state health authorities. So thank you guys for being here with us today, and of course information that we provide here. We also want to continue to emphasize that vaccination is the best way to prevent the spread of this virus and to prevent the severe complications. Dr. Johnson, who is our Chief Medical Officer, will share some of the truths about measles and some of the questions and specific things that we are doing. And so we did want to put on the screen, because we know that vaccination is the best way to prevent these complications, we just wanted to put dates and times that the City Health Department is holding their vaccine clinics. Thank you guys for just being with us today. We hope we will answer many questions, but like I said, the 2 biggest reasons that we are here is we just want to be able to talk about what's happening in our community and then be able to provide good educational resources and information. I do want to say just one quick word about my caregivers. So at Covenant Health, we call all employees that work in our hospital caregivers, from everybody who takes care of a patient to anybody that works in the billing office. We believe that we're all here to take care of patients. And I do want to say that this, my caregivers have been fantastic in the middle of this outbreak, and I would just ask you to keep them in your thoughts and prayers as well. This has been hard on them as we have had so many kids coming in, and then obviously we were not prepared probably so early in what we're seeing to already have a death that's attributed to this. So I do also want to say that the efforts that we have done are not, we have many departments and staff that have helped us take care of this. I remain to be impressed by our staff and just the quick way that we have set up. You'll hear Dr. Johnson talk about, we have set up a shed, for the lack of a better term, where we are pre-screening patients before they come into our emergency room, and just the quick way that we have been able to set up so many things in our hospital to ensure that you're safe. Dr. Johnson will go in to all of these things, but the other thing that we want to emphasize today is we want to emphasize the safety that you can expect if you come to the hospital, and just the different precautions and things that we are doing. So it is my pleasure to introduce Dr. Laura Johnson, who is our Chief Medical Officer, and she's going to have some more specific information on measles, and then at the end of what she talks about, we'll be happy to take some questions. Thank you.
Thank you. I am also a pediatrician and a pediatric hospitalist, and have had the opportunity to participate in the care of some of the measles patients that we've seen in the hospital. So I just want to reemphasize some of the things that Dr. Thompson has already said. We've seen about 20 patients who've required hospitalization with confirmed measles, as well as a handful of patients who presented to our emergency department but did not require ongoing hospitalization. For these patients, they've ranged in ages from infants, school-age children predominantly, and some older children as well. What we see with these patients is really what we see classically with measles. So in general, the clinical presentation of measles is one that has high fever associated with it, and then a constellation of respiratory symptoms: red, watery eyes, significant nasal congestion, and cough are the hallmark symptoms, and then proceeding with a rash. And that rash is pretty characteristic, starts generally on the face and then spreads down the body. So one of the questions that I get asked a lot is, why have patients needed to be in the hospital in this situation? And the answer is really because of those respiratory symptoms. Measles is a respiratory virus that causes a viral pneumonia that may necessitate some extra support for those patients while they're trying to recover. And so we've had patients who've required treatment with supplemental oxygen and sometimes higher levels of oxygen in order to help them with their breathing while they're recovering. Measles is an incredibly contagious virus. So one of the reasons why we see an outbreak situation is because measles is very contagious and spreads really easily among those who are susceptible or who aren't immune. So we know if you're in a room with someone with active contagious measles, you have about a 90% chance of contracting that illness if you are not immune. So a very contagious virus. It's an airborne spread, so spreads via particles in the air. Certainly, just to talk a little bit about what we've been doing at Covenant Children's in terms of taking care of the community during this time, Dr. Thompson alluded to some efforts in our emergency department to make sure that when patients are coming in, we're able to screen and kind of touch base as to whether we're concerned that they might have measles, so that any patient presenting with suspected measles, we can just treat a little bit differently, taking directly back to a room to avoid having them in the waiting room or potentially exposing other patients and families. Certainly there are any number of recommendations in terms of making sure that we're appropriately taking care of patients in the hospital, what we call isolation precautions. We have special negative pressure rooms that these patients are placed in, and then healthcare providers and others taking care of the patients use appropriate PPE or personal protective equipment, including N95 masks and things like this, to reduce the risk of spread of the virus. I think just one other thing that I want to touch base on that is so important is, the best way to contain a measles outbreak is through vaccination. We're very very lucky to have an extremely effective vaccine for measles. Having 2 doses of measles vaccine confers 97% lifetime immunity. So for those of us who are fully vaccinated against measles, the risk, a lot of people are worried about what's your risk in the community. Your risk is extremely, extremely low of having any issues at all with measles. The risk with measles is really for those who are not immune, who have not been vaccinated. And in that population, as I said, it spreads very, very quickly. So certainly we mentioned that we've got some information about vaccination clinics that the City of Lubbock Health Department has made available, including over the weekend. You know, I really encourage everyone to make sure you know your vaccination status, and if you're not fully vaccinated, if your children aren't fully vaccinated, this is a great time to take advantage of these opportunities in order to be fully vaccinated, to protect yourself and your family during this outbreak. I think those are the major points that I wanted to talk about, so I think we can transition to questions.
Dr. Johnson, hold on 1 second.
Yeah.
We're getting a little bit of sound
A little.
issues.
Yep.
If I turn that off and we just use your microphones, is that better? Go for it, Dr. Johnson.
Okay, great. Yes, question.
I'll ask one question, I'll come back later, but we've talked to parents of little ones.
Sure.
Under 1 year old who can't get the measles vaccine.
Sure.
What do you tell those worried parents
Yeah.
who feel their kids are susceptible and they don't even want to take them out?
Right. So, you know, this time of year, this is respiratory season anyway. Independent of the measles outbreak, we have cold and flu viruses and all of those things. And I would say for young infants who are too young to be vaccinated, we want to be cautious about community exposures for measles, but also for all the other viruses, RSV, flu, et cetera, that circulate this time of year. So that usual precaution about just avoiding interaction with crowds and all of those kinds of things for those infants is appropriate. Now, I do think it's important to communicate with your physician for infants, especially 6 to 12 months. So that population is a little bit different, only because we can, in certain contexts, give the measles vaccine early. That's a conversation to have with your pediatrician. It's not been universally recommended yet for all the areas that are impacted by the outbreak, but it is a conversation that can happen. And certainly if those younger infants are exposed. So, for example, if a 7 or 8 month old had a known exposure, we would absolutely want to immunize that infant within the first 72 hours of that exposure. That's the most effective, what we call post-exposure prophylaxis, to try to limit the risk of that infant contracting measles.
And I'll just add, to that. She talked about, you know, this is respiratory season, and sadly, we also experience, unfortunately, childhood deaths from flu and RSV and other viruses. And that's why I would underscore the stuff that you know to do. Wash your hands a lot. You know, when you go to the supermarket, wipe off the, you know, there are things, wash your hands. Stay away from people who are sick, like some of those things, because we're talking today specifically about measles, but unfortunately there are also deaths that happen from some of these other common viruses as well.
Sure. What was the age of the child who passed, and did they have other comorbidities?
So I can't get into specific details about the patient. I can tell you the child was a school-age child, but other than that, I really can't get into any further details.
Based on the numbers of measles, and you have 1 death now, was it inevitable that you would see a death here? And do you think that there could be more?
You know, I think what we need to know about measles is a very severe illness that has a mortality rate of about 3%. And so knowing that when we have large outbreaks, you know, unfortunately, statistically, there's a significant risk of having a death. I certainly hope we don't see any more, but I think we're fairly early still in this outbreak. This has been going on about 4 weeks. We see the numbers increasing pretty dramatically with each update, and so, you know, I think we're just going to have to see what happens.
And
Yeah.
also, as sad as it is, can you paint a picture of how serious it is? A lot of people think measles is a lot of spots and a fever.
Sure.
But really, if you could describe what it's like to die from measles, or can you not breathe, or the swelling, can you explain how difficult that is, how dangerous it is?
Sure. First of all, measles is a deadly virus, as we just talked about. So measles can be very dangerous. The predominant issues that we talk about, and certainly that have led patients to be admitted to the hospital, are those respiratory issues. And so that is a frequent cause of death. There are also neurologic issues that can happen acutely, encephalitis, swelling of the brain, blindness, other issues along that line that can also be a part of acute measles. And then what we don't talk about as often because it's something that happens after, but there is an additional neurologic complication that occurs years later after measles infection. That is a fatal neurologic complication that can occur, 7 years after the initial infection. So measles is very serious. There are lots of childhood rashes and fevers, and as parents, we all know that our kids get these here and there. This is not that. This is a much more serious illness that has much greater risk of serious complications.
And I should say, just because I just mentioned these other viruses, 3% is a high percentage of complications from the measles. That's a higher percentage. While we do see deaths with other viruses and stuff, it is not at that 3% level. So 3% is a high complication rate.
Yes.
Was this student, or was this school-age student in any kind of public schools, or is that something you can hint at?
I really can't give you any specific details about any particular patient. So I'm sorry about that. Yes.
I've got a few questions. In the community, we've been seeing and hearing a lot of people seizing on the fact that there are a few vaccinated cases to argue, oh, vaccines don't make a difference. Are any of your hospitalized patients vaccinated? And what do you just say generally to the people who say, like, oh, see, there are some vaccinated cases here, so vaccines don't matter?
Yeah, the patients who have been hospitalized, they've all been unvaccinated. And I think it can be hard in the midst of an outbreak when we're hearing a lot of information, and when sometimes people may report that they've been vaccinated, and how certain are we of that? What I would say is the best data really speaks to the overall vaccine efficacy, which is 93% for one dose and 97% for two. And I think that that's an important thing to hold in our hands about how well the vaccine works, knowing those numbers.
And then what would you say to people who say that the outbreak in Texas isn't unusual, that measles outbreaks happen every year in America?
Sure. So I graduated from medical school in 2002. And when I graduated from medical school, I was confident I would never see a measles outbreak unless I chose to work internationally, because at that time, we were confident that we'd eradicated measles from the United States and had really gotten to a point where we just didn't see these kinds of outbreaks happening. Obviously, that has changed over the last 20-something years. And so we do see outbreaks more frequently, but that is related to how much we're vaccinating our population. When we think about vaccine-preventable illnesses, they're only preventable if we have adequate vaccination rates. And as we see those rates start to decline, across the nation, then we'll see more outbreaks. Because if you have high vaccination rates, then even when you do have a case here or a case there, or a little outbreak here or a little outbreak there, it can't spread because you have this cocoon of non-susceptible individuals who are vaccinated, and therefore the virus doesn't go anywhere. When you have individuals who aren't immune, then that gives the virus the opportunity to spread really rapidly. So it is different. It is different than it was, 20-something years ago. We are seeing more of these outbreaks, for sure.
And lastly, were you involved at all in the care of this patient who died?
I was not involved with this particular patient, but I have seen some of the other measles patients that we've cared for. Yes?
Of all the patients that you've seen, hospitalized and just coming to visit for checkups with measles, are you seeing more severe cases in unvaccinated people?
Yes. So, in general, almost all the cases are in unvaccinated people. I think it's important to kind of hold that, not only the hospitalized cases, but even the cases just in general that have been reported. So measles cases in vaccinated people are extremely rare. And I can't speak to the reports of individuals who may have been vaccinated who may have tested positive. So I can't get into that, but I think it's just important to recognize that measles in someone who's vaccinated is an extremely unusual occurrence. Yeah.
Just to follow up here. HHS Secretary R.F.K. Jr. was at the White House speaking today and mentioned the outbreak here in West Texas, but he also said that the majority of the hospitalizations were for quarantine. You're making it sound they're not quarantining here, right?
So we don't hospitalize patients for quarantine purposes. So quarantine, certainly if you've had an exposure, there are indications to quarantine in the context of measles, but that quarantine is not something that would happen in a healthcare facility. We admit patients who need acute supportive treatment in our hospital.
So if they're here, they're getting, tell us again, what kind of treatment?
So that generally, so it's what we call supportive care, which is primarily because of the respiratory issues going to be respiratory support. So supplemental oxygen, maybe high flow oxygen, escalating that support as needed. Most of the time patients certainly have high fevers. We're going to give medicines for the fever. They may need IV fluids and support in that fashion because they're not feeling well and ill. And then obviously depending on the complications, there may be other things that are needed. Yeah. Yes?
Just to confirm the number of patients you've seen, is it about 20 or more than 20?
That's a good question. So I think about 20 is the number I'm going to lean in on in terms of the patients who've been hospitalized. Yeah, absolutely. Yes.
Does the effectiveness of the vaccine change depending on the age when it's first administered?
So yes, in the sense of if we give the vaccine early, 6 to 12 months, that may not confer as much lifelong immunity. So in general, if you give the vaccine early, there may be a recommendation to get an additional dose later, so a total of 3 rather than a total of 2. But if there's been an exposure or a consideration in the situation of an outbreak, that may be a reasonable decision to make.
And when would you recommend that 3rd dose?
So there is kind of a recommended schedule. The usual schedule is 12 months and then 4 years. And so that 3rd dose happens, it has somewhere in there. But that's something that can kind of be worked out with the pediatrician.
Do we have any identified adult cases of measles currently?
We do not have any hospitalized adults, but we have seen some adult patients with measles, yes.
And also, if in doubt, if there's anybody that has not had, or they don't remember or have records of child vaccine, where should they go? Where should they find that information?
So if you're uncertain, I would go to the health department and receive a vaccine. I think that's the best answer. Certainly, depending on the age of the person, the ability to have records of that previous vaccine may vary. We've had an immunization tracking program in Texas for many years. So younger people, we may be able to identify that if they've been in that tracking. But certainly someone who's, my age might not know. And so I think that's always it's always a good conversation to have with your healthcare provider. But in this context, if you're not sure of your immunity status, I would get a vaccine because that's going to be the best protection.
And I'm gonna add to this 2 things. Number 1, this will tell you how I'm older than her. And so when I was a tech student, we actually had some cases of rubella, and that is, if you think of MMR vaccine, that's measles, mumps, and rubella. And so when I was a college student, I actually had to get another MMR because they had enough rubella cases that we were all required. And so the reason I want to say that is there's not harm in, if you don't know, that the default is you can have another vaccination. So, because we did that with that rubella outbreak. The other year, and I'm looking to you to make sure that this is right, but there is a year if you were vaccinated before, and I think it's 1957. Is that 57? Okay. If you were vaccinated before 1957, you should absolutely talk to your physician to make sure that you
67,
not 57.
Yeah, If you were
Okay.
born before
Thank you.
1957, then you probably had measles because that was when we didn't have vaccination. And
Okay.
so there is that almost everyone born before 1957 has immunity because they had measles when they were young. There was a period of time with vaccination that was perhaps just different than our current vaccine. So there are those considerations.
Yeah, thank you. I wanted to make sure I had that right.
You talked about safeguards you're
Yep.
handling at the hospital. So what would it look like if I went into PDIC right now? Does it look like it did during COVID when you had the protective gear and you're spraying? What does it look like?
Yeah, it's a good question. And we've talked a lot today, and I'll be honest, I joke, you're going to be the first one that said COVID, not me. And the reason I say it is because we want to be really careful today. The last time I did one of these press conferences was unfortunately when we lost a kid with complications of COVID. But I do want to first say this is not COVID. And that's a super important thing to point out. This is a whole different thing than what we were seeing in the COVID epidemic. You're going to hear some of the similar things, but it's a very different thing because this is a vaccine preventable disease that we had eradicated, and you also treat differently than what was happening in COVID. And so, like, you were getting questions, about like, should everybody be masking? Well, I mean, the reason that the answer to that is no is because if you have the vaccine, you're not going to get the measles, and you're not going to be somebody who's going to give it. And so it's just a different context. But the answer to your question is we've got safeguards. I actually see some of our folks from Covenant Medical Group that are here with us. Even in the clinic setting, we have things set up as this measles outbreak that, like, I'll give an example. At our urgent care centers, we're asking patients if they have some of these symptoms to stay in the car, and then we're coming out and doing those things. We talked about this shed that we have at the Children's Hospital, where we're screening everybody that walks into our emergency room, and if we see anything that looks like this, then we are taking them directly to a room. We're putting masks on, and then Dr. Johnson talked about this negative pressure. And so what the negative pressure rooms do is allow you to not allow any of that infected air, essentially, to go out of that room. And so it's on a separate kind of system that's going to take that air in a different way. So we have all of those things. We did use, for whatever it's worth, negative pressure rooms and things in COVID. So that's where we have the technology to set the rooms up. We have, over 20 rooms at this point that we have went ahead and set up at the Children's Hospital, because if we have more patients, we want to make sure that we're set up for those patients in negative pressure rooms. I'll tell you the one thing that if I wanted to compare it to COVID, what is my number one concern? And one of the things we want to make sure that we communicate today. During COVID, one of the things that I saw that distressed me the most is people who were choosing not to come in for health care because of fear, if that makes sense, like of coming to an emergency room or something like this. And I want to make sure that we get the message out today. Like, we have precautions in place. If you are vaccinated, you are protected, and this is not the time to not bring kids in for other care. So if you have a kid who is having an asthma exacerbation, it is safe for you to come to the hospital. We're going to have a process where we can, do the screening. And even if you're admitted to the hospital, you're in a safe environment where you're not going to contract the measles by just being in the hospital, if that makes sense. And that's an important part that I did see during the COVID epidemic, was people afraid to come in. And so that's an important thing for us to point out, that we've put safeguards in place.
You're wearing protective gear, so are you wearing?
We are. And that's those isolation precautions that we talk about. And so there's different isolation precautions based on how something is contracted. And so there's some things that are contact isolation. So if you touch something that someone has breathed on, essentially, that have had spittle on, you can contract that way. There's some respiratory things. There's airborne. There's some different ways that you can contract. So based on measles, we have you on specific isolation that includes negative pressure and includes masking. And we talked about the N95. So we have specific isolation requirements that we do specifically for measles. And I'll contrast it with RSV, which I've already mentioned today. That's different precautions than we would put you on if you had RSV. So we're very specific to those viruses in terms of how we isolate you.
And while it's not COVID, it is 12 to 18 times more infectious, is that correct?
I don't know what the 12 to 18, I don't know if that's, but the answer is it's one of the most, measles is one of the most infectious agents that we know. So I don't know if that's the actual number, but it's very high.
Although we know that there's a large number of these cases originating from Gaines County, do we know where this strain originally came from? It doesn't just manifest itself. Do we know how it started in Gaines County?
I don't think we know that. I can't speak to that. That is part of the overall public health response is doing investigation into that. But it's hard to know. Certainly there are sporadic cases that pop up here and there. I know there was a case reported in Houston and earlier in 25, and there have been cases reported in a number of states, outside of an outbreak situation so far this year. So I can't speak to exactly how the measles virus found itself in Gaines County, but we'll continue to look at it, or the public health team will. Yeah. Yes.
What are requests for more involvement from the federal government that you know of?
So, I would really lean in on our partnership with the local, state, and federal health authorities. So we've had good communication with our local health department. We've had good communication with the state health department and have had visits here. And then there's also been involvement with the CDC as well. So those processes have been working, just as they're supposed to.
Talk about the calls that y'all, like, not only is communication, but like there's calls that you guys are getting on.
Sure, yeah. So both kind of through all those levels, we've had communication that, has not just been a phone call here or there, but organized calls to make sure that calls for providers, calls for the hospitals, calls, communication across all the different stakeholders to make sure that we're all communicating. And as we're identifying additional needs or resource needs, we're able to raise those to both the local and the state authorities to assist with that.
Do you think there should be more federal involvement at this point?
I think from our perspective here locally, things are going about as well as they could be in this context, and I think we've been very appreciative of the collaboration with the health departments, both locally and at the state level. Yes.
I'm hearing from health officials in other cities that they were told to put a hold on sending vaccinated cases to the state health offices, and it's created somewhat of a delay for them. Is that something y'all are experiencing here?
I'm not sure. Maybe could you clarify what you mean about vaccinated cases? I'm not sure.
The cases that come up in people who were already vaccinated, other officials have said that the state health offices are putting a hold on sending those results over to them, but y'all are sending over the unvaccinated results. Is that happening?
I don't believe so. No, I mean, we're testing as indicated by the clinical findings and collaborating with the local and state health departments to run those tests and get the results. So I'm not aware of any concerns with that.
As I understand it, no vaccine is 100% effective. So what does that mean? If somebody has one of the 2-dose series, are they protected enough to avoid death?
So they're 93% effective, 93% protected in the sense that they are unlikely to contract the virus. Whereas if you're unvaccinated, if you're around someone who has the illness, you have a 90% chance of becoming ill from the virus. When we say the vaccine is 93% effective, that means, I suppose, if we took 100 vaccinated people and put them in a room with someone with measles, you could kind of do the math from there. But almost all of those vaccinated people, 93%, would not contract the illness at all. So, the degree to which, for those who do become ill, certainly the symptoms are far less. I can't speak to more details beyond that. But measles vaccine is one of our most effective vaccines. So some vaccines, and I think maybe COVID and flu we could think about in this category, don't necessarily protect you completely from getting ill at all, but they lessen the symptoms, make complications and hospitalizations more rare, those kinds of things. Measles vaccine is one of those great examples of a vaccine that really keeps you from getting sick almost all the time. Completely. And so it's often, an example of one of our most effective vaccines from that standpoint.
And I would also, the only other thing I would add on that is keep in mind that there are many things that happen over your lifespan. And so, like, I'm going to speak because we've got a cancer center here in our hospital. And so certainly when you have cancer patients or things like this that are going on chemotherapeutic drugs, I mean, what that does is knock down your body's own ability to fight off like disease and immunity and those things. And so when we talk sometimes about who gets sick, from these things, you have to keep in mind that what you also have in that category is people like cancer patients who are on treatment protocols that actually lessen their ability to fight off any number of diseases, but would also be like in that category of someone. So that's an important consideration, is to remember you're not talking, when you're talking the 93% of people, and then the 97 whenever you're fully vaccinated, you also have in that number people who either have an immunodeficiency, so they have some genetic reason why they don't do so well with fighting off disease, or people who are on treatments like chemotherapy who knock down their ability to fight off disease. And so my point is, it's all comers that are part of that equation. It doesn't assume that everybody has a fully functioning immune system.
And Martin, I'm looking at my phone. HHS Secretary said there was 2 deaths today at the White House. Do you only know of 1 here?
I'm only aware of the 1 death that has been reported. Yes.
Are there other complications that make it more likely, maybe more people more at risk for worse conditions after contracting measles, or more likely to catch measles or being able to get the vaccine?
Yeah, so age, we've already kind of touched on. Age is a big factor, both in terms of when you can be vaccinated, and also younger infants may be more likely to have more significant symptoms. Immunocompromise that Dr. Thompson mentioned. So if you have issues with your immune system for whatever reason, that certainly can make it more likely that you might have complications and more difficulty with measles. And those are the big categories we worry about. Now, it's certainly true, just in general, patients who have more medical complications. Sometimes we think about medically complex children, especially, who may have significant problems in a number of different ways. They're at greater risk for every infection, may have more severe courses and more issues with that.
And somebody asked the question earlier about the term comorbidities. That's a term that she's talking about, is if you have comorbidities. And while we can not comment on the particular patient that we're talking about today, certainly patients that have comorbidities, we know this, patients who have underlying asthma or something can have more respiratory issues when they get any virus. And if you were a former premature infant, and so that kind of broad category that Dr. Johnson is talking about with comorbidities is always going to increase the severity. If you have respiratory issues, when you get a respiratory virus, that's going to be worse for you.
Given that so many of these cases are coming from rural communities, has that made anything more challenging in responding to this outbreak?
I would just say here in Lubbock, Covenant Children's, we're a regional children's hospital, and our mission is to take care of those rural communities that surround us throughout West Texas and even in eastern New Mexico. And so we're prepared and ready to take care of the population.
I didn't know they were going to play music at the end. All right, so that was the Lubbock Public Health Department update about, it wasn't. It was Lubbock Public Health Department channel. It was the Covenant Health update about the Texas measles outbreak. You could hear they said at their hospital system, they had treated around 20 children, all unvaccinated, and they said, and they talked about the one child who had died, who was unvaccinated, but they said they couldn't release specific information about, who the children were and more identifying details, that kind of thing. It was really striking to hear the chief medical officer said, I think she said something like, when she was in medical school around 2002, she just assumed she would never come across in person. She would never treat a measles case unless she decided to go work I don't, did she say like work in some other country or something like this, I believe? Because measles had been eradicated in the United States. But now overseas, Jazzy Renee said, I couldn't, one of our viewers said internationally. I couldn't remember the exact wording. But she said now she's obviously seeing a lot of them. So I'm going to take a few more comments here. If you missed it, we did a whole segment before the press conference. We did a whole segment talking about measles and the outbreak and with other information about it and stuff. So, you know, I'm not going to repeat everything again. If you want to go back, you can watch it. But certainly, this is we're going to be keeping an eye on this outbreak. We may do more coverage in the days or weeks to come. Something else that struck me is one of the two, there was the chief medical officer and the chief managing officer. I can't remember who the other person was. But anyway, the two hospital officials, one of them said it's early in the outbreak. That's what one of them said. It's early in the outbreak. Also, again, they said if you're in the room with somebody who has measles and you don't have, and you're not vaccinated and you don't have immunity from having had measles before, you have a 90% chance of getting measles if you're exposed to somebody in the room with measles. If you're not protected from having from being vaccinated or having had it before. It is one of the most contagious diseases, they said. Also, there was this number they quoted, 3%. At one point it sounded like 3% mortality, but then they also said 3% complications. I was looking up the online, what is the mortality rate of measles? And Google AI says the estimated global mortality rate is around 0.1 to 2.2%, which would be 1 out of 1,000 or 1 out of 500. I see something from UChicago Medicine that says if 3 in 1,000 children, maybe she meant 0.3%, because there's a University of Chicago Medicine page that says 3 in 1,000 children who contract measles will die. So that would be 0.3%. That wouldn't be 3%. It would be 3 out of 1,000. And then Wikipedia says about 1 in 4 individuals will be hospitalized. I've seen that today, a couple of statistics on that. 1 in 4 or 1 in 5 people gets hospitalized who gets it. And then Wikipedia quoted a figure of 1 to 2 out of 1,000 will die. And then also Reuters said they heard that the mortality rate was 1 to 3 deaths out of 1,000 cases, according to CDC. So I think the person who was talking in the press conference meant to say 0.3%, not 3%. 0.3% would be 3 out of 1,000. But that's like roughly 1 out of 300. And, you know, this spreads very easily. That's not 1 out of 300 serious cases. That's just 1 out of 300 cases. So right now there's officially 133 cases, 9 in New Mexico, 124 in Texas, and 1 dead. But we'll have to see how those numbers progress. And you could see the confirmation. The Secretary of Health and Human Services, Robert F. Kennedy Jr. today said that most of the people hospitalized in this outbreak were hospitalized for quarantine reasons. Well, you just heard the official number of hospitalized is 18, and you just heard in the press conference the hospital system say, we have treated about 20 children hospitalized for symptoms, and they said we don't hospitalize for quarantine here, I believe is what they said. So they were not hospitalized for quarantine reasons. And then I think it was the chief medical officer who told NBC News they hospitalized the people because they were having trouble breathing. Peter Shansel thinks she was saying 3% had serious health complications. At one point, I think they said 3% mortality. Again, it's possible she misspoke, or maybe she was saying maybe she meant to say serious health complications. I'm not positive, but anyways. We'll take a few more comments here. But certainly, I'll keep an eye on this. We may have more coverage as things develop. No, one of our viewers, CP says any report on the immigration status of measles victims. I mean, you heard in the press conference, they said we can't give you specifics about these children who've been hospitalized and the child who died for privacy reasons. So, and I haven't heard specifics about other cases, about who the people were. As I mentioned before, I don't want to go over all this again, but a bunch of cases have been spreading in a Mennonite community, which is a particular religious community, part of the Anabaptist family of churches in Texas, West Texas. So a number of the cases are in that community, but I don't know how many. That's an AP article. Oh, here's another update here. This is from Reuters today. Texas child has first reported U.S. measles death in a decade as outbreak hits more than 130 people. If we scroll down here, it says Laura Anton, a Texas Health Department spokesperson, told a local ABC affiliate that the ongoing outbreak has hit mostly small children and teenagers, and that the cases were originally the cases were concentrated in a close-knit, under-vaccinated rural Mennonite community in Gaines County, where children are largely homeschooled. It's 80 cases there in Gaines County. She said it's all personal choice and you can do whatever you want. It's just that the community doesn't go and get regular health care. At this time, it is unclear how the first person was exposed, and there is no indication that early patients traveled outside the United States. Dr. Peter Hotez at Baylor University said it will accelerate for a while. He said it's a bad illness, noting about 20% of cases are hospitalized. That's a high number. Unfortunately, he said, Texas is the epicenter of it because of our very aggressive anti-vaccine movement. Measles was declared eliminated in the U.S. in 2000, meaning there was no continuous transmission of the disease for a year. In recent years, federal health officials have attributed some outbreaks to U.S. parents refusing to vaccinate their children, Reuters previously reported. In 2024, there were 285 cases in the U.S., up from 59 in 2023. The next official update, the state of Texas Department of Health said that they update the case numbers on Tuesday and Friday. Tuesday and Friday. So I think the next case number update from the state of Texas will be Friday. Unless they change things. Hang on a moment here. Oh, I have something about that vaccine meeting which got canceled. Oh, I have something about the child who died. I have some reporting about the child who passed away from measles. I just saw this. This is from the Washington Post. Texas child is first confirmed death in growing measles outbreak. First measles death since 2015 in the U.S. By the way, thanks so much to our moderators. Ruth Krafasi is moderating right now. Beth Mythical, I really appreciate it. Also, Linda Belk, Larry, and Misha on X. And also on Twitch. Thanks to Hearsay, I Got That Fire, Matthew, Kohai 3, McRitches, Sarah, and Surly Dev. Thanks also Kay Larry Body and Margaret Riley over there on Facebook. Also, thanks for your support, Bad Toastery and Notorious Rob on Twitch. I really appreciate it. Also, thanks for your support, Marguerite Grace, our new member, CK, who says, will the measles reach Altoona, Pennsylvania? I don't know what other states. I mean, it just depends. If somebody who has measles travels to a different state, people there could get it. Or maybe somebody's visiting Texas or New Mexico and they get exposed and then they go back to their own state, you know? So I don't know where cases are going to be detected for this. I hope they don't spread very far, but who knows? Thank you, Loki 1988, by the way. I appreciate your support. Loki believes the most prominent ethnic Mennonite groups are Russian Mennonites who formed as an ethnic group in Prussia, in South Russia. I can't confirm that. That's what Loki says. Thank you, Loki, for your support. Let me show you this reporting about the person who died. Again, AP says Mennonites are part of the wider Anabaptist family of churches which emerged in 1525 as the radical wing of the Protestant Reformation in Central Europe. Okay, here is this reporting about the person who died. Summer Davies, a physician who cared for the child. The person who died is an unvaccinated school-age child who was, and that person was hospitalized last week. Summer Davies, a physician who cared for the child when they were first hospitalized this month at Covenant Children's Hospital here, said the patient arrived with a high fever and struggled to breathe without assistance. The child's respiratory symptoms grew progressively worse, and then heart problems were diagnosed. Several days ago, the child was moved to an intensive care unit and placed on a ventilator before dying this morning. The child was otherwise healthy, Davies said. The patient could have had a long, happy life, and it is really heartbreaking when it's something you know could have been prevented, or that is preventable and ended in something like this. Davies said she had seen about 9 measles patients during the current outbreak. She had never previously encountered the disease. While many children recover from measles, some die of pneumonia caused by the virus or a secondary bacterial infection. Also, measles can result in a rare and fatal long-term complication that generally develops 7 to 10 years later, says the Washington Post. In 2015, a 14-year-old Oregon boy died from the complication 13 years after he contracted measles abroad. Vaccination rates are below average in rural Gaines County, the center of the outbreak where 80 cases have been reported. The deceased child's hometown was not released, but the hospital said the child did not live in Lubbock. Many patients in rural areas with limited healthcare options have been treated at hospitals in Lubbock, one of the closest large cities. Robert F. Kennedy Jr., Secretary of Health and Human Services, today in the Trump cabinet meeting said there have been 4 measles outbreaks this year in this country. Last year there were 16, so it's not unusual. We have measles outbreaks every year. These comments frustrated public health officials who said Kennedy was downplaying the seriousness of the outbreak. Phil Huang, the top public health official in Dallas County, said that's exactly the kind of messaging that is detrimental to public health. I mean, we just had a kid die. The case tally in Texas in the first 2 months of the year has eclipsed the annual U.S. case count for each year between 2020 and 2023. Experts said the data shows an unusually high death rate. Well, there's 124 reported cases and a death. That's a very high rate. Typically, the disease kills about 1 in 1,000 people, he said. It's likely there are many more cases of measles that have not been identified yet, said Paul Offit, a pediatric infectious disease expert at Children's Hospital in Philadelphia. Offit said measles was eliminated in the U.S. in 2000, but outbreaks have been increasing because a critical percentage of parents are choosing to not vaccinate their children because of the disinformation about vaccines that's out there. In Texas, 5 of the people who contracted measles were vaccinated. The rest were unvaccinated or their vaccination status was unknown. So certainly, again, condolences to the family of the child who died. Sounds terrible. And thoughts with all those who are sick with this. I hope they all recover and recover soon. You know, it did say in the press conference we watched, they said several children had required intensive care treatment. Thank you, Firestar, who emphasizes it is a preventable infectious virus. Firestar, was not happy with RFK Jr. So we'll have to see how this develops in the coming days. I do not know how many more cases there will be. There could be people with measles right now who don't know if they have it, don't know that they have it, and they could be somewhere and other people could be getting it. So we will just have to see. Again, I showed you what multiple health departments said and what the CDC said, in that it is the best way to protect yourself is to get the vaccine. Literally, the Texas Department of Health. The best way to prevent getting sick is to be immunized with 2 doses of a vaccine against measles, which is primarily administered as the combination MMR vaccine. We'll take a few more comments here. Hang on a moment. Bart Garcia wrote in and said, Buc-ee's is the famous stop between UT San Antonio and Texas State in San Marcos. We mentioned Buc-ee's because earlier I showed you a Texas Department of Health alert saying that people could have possibly been exposed to somebody with measles at various locations, and one of the locations was a Buc-ee's in New Braunfels. And by the way, you can find lots of information about, I'll post a link to the page. We went over it before, but I'll post a link to the page. For example, you can find a lot of information on the CDC page about measles, symptoms and stuff about the vaccine and all that stuff. I'll post a link in the chat right now. But there's a lot of helpful information on their site. How is it transmitted? Yeah, so we covered this before, but real quick, I'll just mention this again. It is it spreads through the air when an infected person coughs or sneezes, says the CDC. You can get measles just by being in a room where a person with measles has been. One of the other sites we looked at said, yeah, somebody just breathing in a room can cause it to spread. This can happen up to even up to 2 hours after that person has left the room. How common ways it spreads. Measles. Contact with an infected person. It can spread to others through coughing and sneezing. Contact with air droplets. If other people breathe the contaminated air or touch the infected surface, then touch their eyes, noses, and mouths, they can become infected. If you have measles, up to 90% of the people close to you who are not immune will also become infected. An infected person can spread measles to others even before knowing they have the disease. You can spread measles to others from 4 days before through 4 days after the rash appears. So I guess in theory, somebody could sneeze on a surface or cough on a surface, and then a person could touch that surface and eventually get measles from it. One of our viewers said Facebook is down. Is it the Facebook stream, or is it just... I'm not seeing any errors here. Maybe Facebook itself is down. I don't know. I mean, periodically... Yeah, Facebook looks like it's not working right now. I think Facebook is not working right now. I don't normally rush on the air to cover it. I mean, if it stays not working for several hours, maybe I'll cover it. But I just tried going on Facebook, and I couldn't get on it. So... Looks like a lot of people are having problems with Facebook, though. So somebody said it's working for me. Some people online are saying they're having problems with it. So some people are saying it's working for them. All right. Well, look, guys, I think it might be about that time to wrap up this stream, I think. Let me just do one last check and see if I see anything. But we will certainly keep an eye on this story. I got to keep checking the local counties, what they're saying. By the way, the New York Times points out that in Gaines County, where 80 cases are of this in this outbreak, last year, roughly 82% of Gaines County had received the measles vaccine. Experts say at least 95% of people in a community need to be vaccinated in order to stave off outbreaks. Okay. Yeah, I'll keep an eye out for other announcements about this. Yeah, my Facebook is like not working. Oh, now it's working again. Now it's working. Okay. We're back. It's working. Toast and Loaf says, I have a feeling this is going to get much worse. I hope not. Yeah, I'll have to go through some of the different localities and look them up and see what they're reporting. If there are any more kind of, I expect to see some more alerts about like, if you were in this place at this time, you might have the measles. Or measles. All right. I am going to wrap up this live stream. I really appreciate you guys being here for this. And again, if there's significant updates on this, we may do more coverage of it. So keep an eye out. Thank you for joining us, and I hope people stay safe in Texas, and I hope everybody who has this has measles right now is recovering and recovers soon. Subscribe and follow the channel, Agenda Free TV. We cover all kinds of live breaking news without an agenda. I don't know when we're coming on in advance most of the time, depending on when news, depends on when news happens. Although I think tomorrow we'll be covering the press conference with President Trump and UK Prime Minister Keir Starmer, which is supposed to be around 2 p.m. My guess is it'll start late, but my plan is to cover that press conference with President Trump and Prime Minister of the UK Starmer tomorrow. So we'll probably be covering that. But if you want to get notified when we go live, which is good because a lot of times I don't know in advance when we're going live, sign up for our free notifications. They work great. We do it through Discord. It's free. Sign up for the notifications. Make sure you signed up. The mods will post the link in the chat to sign up for the notifications. Also, you can find the link on Facebook and YouTube in our description for this video. The link is there. So make sure you sign up for the notifications. And I will post updates on my X account as I have been doing, which is @Lookner on X. You can follow me there. I'll post the link in the chat, @Lookner on X. And thanks, by the way, I owe a thanks to JJ's Digest for being a member and Boomer Wow for your support. Thank you, Boomer Wow. And PZ Papa Zulu, Pam Bondi Epstein info tomorrow sent to you on X. Thank you, PZ Papa Zulu. You know, I saw something about maybe some Epstein information coming out tomorrow. I don't know. I'm not assuming there'll be some black book with lots of names of people and details about what they've done. That's just my guess, is it won't be that. Maybe I'm wrong. Maybe it will be. I guess she said something about some stuff being released, I guess, tomorrow. I just saw something quickly about it. I'm not sure. I'd have to go back into the details of what she had said, but I wouldn't just assume. I think there's the thing that people are hoping to see and then what we'll actually see, and they may be quite different. Thanks for a message. I appreciate you bringing that up, PZ Papa Zulu, though. Yeah, I'd have to watch. Yeah, so I guess she said on Fox, tomorrow you're going to see some Epstein information being released by my office. You're going to see a lot of flight logs. This person, Asin, posted a clip from Fox News. Hold on a second here. So she said that tomorrow you're going to see Epstein information, a lot of flight logs, a lot of names. I mean, aren't there Epstein flight logs which are already public? Also, if somebody took a flight with Epstein, that doesn't mean that they did anything else. So again, I just want to moderate people's expectations. If such information comes out, what you actually might be seeing. So who knows? I don't know. I'm just, I haven't seen specifics about, information coming out incriminating people. Anyways, we'll see what happens. Thank you, PZ Papa Zulu, for bringing it up. I appreciate that. Thanks for all your support, too. Really appreciate it. Hey, thanks to our moderators for being here. I'll keep an eye out tomorrow. Thanks to our moderators for being here. we have, we cannot have chat rooms without our moderators. They are incredible. They are awesome. They're always here keeping things civil and respectful in the chat. So thank you, Ruth Krafasi over there on YouTube, Beth Mythical, all of our YouTube moderators who have been there. Thanks so much. One of our viewers just said, is Travis County in danger? By the way, I mean, it's, this virus measles could spread wherever people who have it go if other people are not vaccinated and haven't had it before. So it just depends on where where it spreads depends on where people who are infected go with it and whether other people get infected. There's a lot of counties people already are. The Travis County isn't on the list yet, but we saw a report that I think the health department said that there were people. We saw a report that people that there might have been an exposure, that somebody who tested positive was in San Antonio, in San Marcos area. So I don't know what other counties there will be cases in. Hopefully it doesn't keep spreading, but it just depends on where do people with the virus go and do they spread it to other people there. Now, hopefully with more public awareness of it, maybe if people say have like early symptoms, which might be, measles, maybe a month ago they wouldn't have thought about it and said, oh, I have a cold. Maybe now they think, oh, I should go to the hospital and get tested, or I should isolate myself, So maybe that helps slow things. If you have people who are symptomatic isolating themselves and also, going to a hospital and getting it checked out. So maybe that helps slow it down. But I don't know. I don't know where people have gone and how many people might have it already who are just not showing symptoms yet. Ralph Walters says, need to get ahead of this outbreak. My fear is that it's a mutated strain. I have not heard yet anything suggesting that somehow this is some radically different strain of this virus, but I don't know. I don't know how much they even know about this strain. But nothing we've heard so far says, wow, this is acting so different. But we'll have to wait and see what happens. It's just known it is one of the most contagious diseases out there. Yeah, Teddy Boy says it depends on how many people have not been vaccinated. That too. Does somebody go somewhere where there's a bunch of people who are there who are not vaccinated? Thanks. I was thanking the moderators. Sorry, Ruth Krafasi. Thank you again, Beth Mythical, BZ, all of our YouTube moderators. Thank you so much. And also over on Facebook, Kay Lowry Body and Margaret Riley. Really appreciate you being there. Thank you. On Twitch, all of our moderators, I Got That Fire, Matthew Kohai 3, Mick Britches, Sarah, Surly Dev, thank you. Linda Bell, Clary, Misha on X. Thank you to all of our moderators. Thanks to everybody who donated. I very much appreciate it. And your support is what allows this channel to stay on the air. So thank you so much for that. I think I thanked everybody. If anybody ever wants to donate, you go to agendafree.tv, agendafree.tv. But big thanks to you for supporting the channel. What was I going to mention? Another good way to find out when we're live is follow us on X, which is @AgendaFreeTV. I always post there when we're going live. I post updates about the channel there. So follow us on X, @AgendaFreeTV. And also, if you do watch on YouTube, I'd suggest turning the YouTube notifications on. They can be very helpful in telling you when we're live. To do that on YouTube, what you want to do is you subscribe to the channel, and then once you subscribe, you got to click this notifications bell here, activate the bell, and then choose all notifications. Thanks to everybody who wrote into and let me read your comments. I know I didn't get to everybody's comment. There was a lot of comments, but I really appreciate people writing in and also people participating in the chat. So thanks for and your comments and your questions and your updates. Also, hey, thanks to our Twitch subscribers for supporting the channel. Thank you. Like Pixie T and Jack's Animals and Wall Street and Shaggy, Distant Galaxy 13, Bad Toastery, Drunk Can't Cook, JRG 770, I Got That Fire, Cerebral Drip, Chi-Town Bear. Thanks for being subscribers. Burge 56, Gina Pina, Jazzy Renee, The Sugaro, and all of our other Twitch subscribers. Thank you so much. Our Facebook subscribers like Eve Richards, Lou Green, Robert Real II, Kay Lowry Body, Margaret Riley, Diane Allworth, and all of our other Facebook subscribers. Thank you. And Kristen McConnell Gates. And our YouTube members, people like JJ's Digest, Raven Knight, Evelyn in Maine, PZ Papa Zulu. PZ Papa Zulu says, I just spoke with my daughter in Lubbock, Texas, and the schools are not closed. And by the way, as you heard in the press conference, if you have been vaccinated with 2 shots, you're 97% protected, and also you're as the state of Texas said about the vaccine, the Texas State Department of Health said that. I'll just read you what they said, just to emphasize this. Where is it here? Yeah, that a small number of vaccinated people can occasionally develop measles. In these cases, the symptoms are generally milder, and they are less likely to spread the disease to other people. So, if everybody at a school has been vaccinated, there is not going to be a high risk for people at that school. That was what was said. You heard in the press conference them talking about you're low risk if you've been vaccinated. And all of the children hospitalized that they had treated in the hospital system, that was in Lubbock, I believe, tonight, the press conference we were listening to, they said all the hospitalizations were for people who were not vaccinated. So my point about a school would be, if the people are vaccinated at the school, they're not going to be at high risk. Let's see here. Thank you to Eliza Jane, our YouTube member, Susie Irish, Naomi Nocturnal, C Chase, Brian Tampa. Brian is a new member, he said. Thanks, Brian. Oh, Brian's not a new member. Sorry. Thank you, Brian. Yeah, I thought you had been a member for a while. Thank you, Brian. I appreciate your support. Jen's Crunchy Vax, Darren, 175. Thanks for being a member. Evelyn in Maine, Armor of God, Jagged Glass, Callie Graham, C Chase, Anae, Aaron McCune, Stacy Bashford, all of our other YouTube members as well. Nurse Zigzag, Raven Knight, Aleppo Gambit, Nicholas Browse. And, oops, hang on a second here. And all of our other viewers, I really appreciate you watching. We're going to wrap this up. We're wrapping up the stream, guys. We are wrapping up the stream. Okay. Thanks, Dina May, for watching too. Clarabelle Signs, thank you. Clarabelle lives in Lubbock. Thanks, Melissa Terry, as well. All right, guys, so that is it for now. If you missed it, you can rewind the coverage. We played the press conference. Before that, we talked about the outbreak. We talked about some specifics about measles. So feel free to rewind and check it out if you haven't seen it. That is it for now. I will keep an eye on this. If there's new updates, I'll post them on my X account. And if there's new big news, we can certainly do another stream on this. I hope we don't have to do another stream on this, but I don't know how this is going to keep progressing. So that is it for now. Thank you so much for watching, and we'll see you soon with more live breaking news coverage right here at Agenda Free TV.